and he's cutting through the windscreen. You can see where that sheet comes in because it stops any glass falling inside of the car and getting onto any casualties that may be there. The other guys are just working around the vehicle. What they're doing, it might be difficult for you to see, but all the plastic, what we call trim, and the seals around the doors, they're removing that. They're having a look behind. In vehicles, you get seatbelt mountings, you get fuel lines, you get other pieces of metal that might be difficult for us to cut through or might present a safety hazard like airbags. So the guys are just looking around those areas because we're going to cut through there. So we want to make sure that if we cut an airbag, it's not going to go off, we're not going to start leaking fuel, or there might be an area that would be really tough. Again, John from this side, those guys over there you probably can't see, but he's putting a protection over the steering wheel. The airbag on this car hasn't deployed. Airbags can go off with quite a charge. It can present a real hazard to us if we're working in the car. So if the airbag hasn't deployed, we're going to put a cover over that, so if it does go off, it won't fly out and hit one of the guys or a casualty.
Hey, look, what are they doing?
So the guys now at the rear, they're just looking to remove the tailgate from the car. If we left the tailgate on, it's quite heavy, so that just makes it more difficult for us to take the roof off. So before we start cutting through and taking the roof off, we're going to get that tailgate off. As you can see, they've taken all the glass out. All the glass has now been managed, with the exception of the windscreen. We don't need to worry too much about the windscreen because it's called laminated glass. So it's like glass covered with a film of plastic, so it doesn't shatter like toughened glass would, so we can leave it intact. Right, you can see Ricky is just getting out the reel, ready to get the hydraulic cutters. Some of you came around the back of the truck earlier, so you might have seen how these worked. Now you're going to get the opportunity to see how they actually cut through various parts of the car. So there's going to be a bit of noise when he starts to pack up. So again, moving on to our simultaneous activity, while one crew works one side with the cutters, we're going to get crews in other areas working with the electric saws. That way again it reduces the time, means we can extricate people a lot quicker. I don't know if you can see, but in the back of the car, just tell you what's happening. There's one female casualty, and she's in there with a member of the ambulance service. The ambulance service will be obviously constantly monitoring them and letting Stu know about their condition should it deteriorate. While we're cutting away pieces of the car, obviously small bits of debris might fly about. So what we do, you can see the guys that have got the big green sheet there. We will cover people with the green sheet. That's what we call soft protection. Also, as they're cutting and using the tools, you can see plastic pieces of equipment. There's a clear one, there's a blue one. We call those teardrops. We can put those in between the tool and either the person cutting and the casualty, most of the time both. And then if something does ping off, what that means, it's going to hit the teardrop and it's not going to hit the tool operator or the casualty. So there's a good example of that, and Ricky's just cutting through the front part of the windscreen, which we call the A-post with the cutters. So what will happen, they will work round in that fashion. So Ricky and Steve will now move to the back of the vehicle, going through each post. We normally make the last cut closest to the casualty. That's for the benefit of the casualty. If you make a cut by the casualty first, most of the time the casualty will be aware of that and they will hear that. And they might think, oh, they're near me, we've nearly finished. So we always do that last, so they don't think why they're taking so long, they've already been cutting near me. So with road traffic collisions, you have to constantly assess the situation. So what you'll see is, as things are happening, the guys will go back and they will check the stair blocks to make sure the car is stable. They'll keep talking to Stu to get updates on any changes in the plan. So just moving around to the front of the car, you can see that they've cut through this area. This is what we call the A post. We mark posts A, B, C, D accordingly. So this is the A post, this is the B post, and obviously this rear one will be the C post. They've gone through the A post and the B post With the hydraulic cutters, you can see they're quite narrow. This post to the rear, the C post, that's quite thick. So you can see our cutters are only about so long. It's going to be difficult for them to cut through that with those hydraulic cutters. So what they'll probably do, as that's closer to the casualty as well, that will be the last cut. They'll probably use an electric or battery saw to cut through that post, and they can go straight through. I don't know if you can see they've scored a line, and that's the line of where we want to be cutting with our saws. And again, that comes back to the guys looking behind the trim, seeing what's there, making sure we're not going through seatbelt mountings, things like that. So again, Ricky and Steve are just about to cut through the A-post this side of the car. Again, they've got their cutters in place, and you get a good vantage point from here. You can see how easily those cutters go through that piece of metal. So again, far side of the car, the guys are going through the back seat post with the saw. So now Ricky and Steve are cutting through the, oh, it looks like they've done it, they're too quick, through the front A post. That just should leave just one more cut, this rear C post. So as I said, we will always do the cut closest to the casualty last. It looks like Peter's going to move around and make that cut with the saw. Like I said, you've got a good vantage point of the cutters then, the sort of distance that they can cut through. Ricky, can you just hold the cutters up, turn around? There you go, they're very good, but they're quite short. So it'd be very difficult for Ricky to cut through that in one go. So it's just quicker to get Peter on the saw, and he can go straight through that area. The saws are very fast and they're very tough, and they should just get straight through there. Oh, they're going for a two-pronged approach, so Pete's cut halfway with the saw, and then Ricky's going to move in with the cutters. Again, you can see how easily those hydraulic cutters just go through that post. But again, you can see they were limited by the distance. Now Peter's just continuing that cut along with the saw. So just finishing that cut up now. What's going to happen, we'll get some of the gear away, because some of the stuff we don't need, we can just get that out of the way, like the saws, the cutters, we can knock the power packs off, etc., because they make a lot of noise. Stu will reassess the situation. He'll probably check the stability again, make sure the car's not going to move. At some point now, we're going to have to get the roof removed, and we're probably going to have to get people in the car so we can start lifting that casualty out on what we call the longboard, and you'll see that in a second. So it looks like they're ready to lift the roof. Stu would have decided, and he would have told them where he wants the roof to go, either forward or back. Basically what he's saying to him, we always have a thing, we say, is there anybody that's not ready? If we say, is everybody ready, then yeah, ready, ready, and there might be someone that's not. So we say, is everybody not ready, then it's normally 1, 2, 3, lift. So you can see they decided to take the roof forward. The reason they've done that, the casualty's in the back, so you take the roof forward, that's less of the roof going over them. There you go, so what we think are nice solid cars, they break pretty easily, to be fair, they're not that tough, so. Right, the guys are going around, they're just checking the stability again. As pieces come off the car, sometimes the car can become less stable, so we need to make sure that that car's going to move as little as possible. All the posts that we've cut through got horrible, sharp, jagged edges on them. We wear a lot of kit, but we can cause quite a nasty injury by coming into contact with those. So those yellow things you can see put over there, they're called post protectors. They're for our protection and the casualties protection, to make sure that nobody can injure themselves by cutting themselves on a sharp edge. Get a better view now of the airbag restrainer that's over the steering wheel. Right, what's happening now? The guys are just removing some of the gear that we don't need, just tidying things up a little bit. Stu's just talking to the ambulance. He was finding out the best way, according to their injuries, to remove that person from the vehicle, okay? So they've probably told him that. He's now briefing the crews, designating tasks for certain people about what he wants to
do. And we'll often have surgeons coming to join us, neurosurgeons, depending on the type of injury. Because this is a child that's been injured, we will pre-alert the paediatric intensive care team. So these are the people that are specialised in looking after kids, and this is very important to have this really early specialist input, and it improves people's outcomes.
Okay, hello everyone. Can I have everyone's attention for a second, please? We've just put out a trauma call for a child that's coming in our way. I'm Sanjay Ramamurthy, I'm one of the ED consultants, I'm going to be trauma team leader. Can we just go around first of all and let everyone introduce themselves so we all know names and roles, please?
I'm Kim, PICU and Airway.
Jane, PCD consultant.
So it's incredibly important that everybody knows each other's names and each other's roles. No two trauma teams are ever the same. So this assembly of people will probably never have worked together before in this setup. They may know each other, they may have worked together before, but in this exact setup it's probably never happened. So it's important to know everybody's names and to delegate jobs and let everyone know what the plan is.
Thank you very much, everyone. If I could just have everyone's attention to read out our handover, please. We're expecting an 8-year-old girl who 30 minutes ago was a pedestrian hit by a car, approximately 30 miles an hour. Injuries from top to toe that we know of. She has a head injury and bilateral femoral shaft fractures. Signs are a heart rate of 110, blood pressure is 95 on 45, with a prolonged capillary refill time of 3 seconds and a respiratory rate of 20. Treatment, she's had an RSI at scene by the pre-hospital team with ketamine and rocuronium, and she's had a pelvic splint put on, and her ETA is going to be within the next 10 minutes. So, has anyone got any questions about any of that? Okay, so we're going to allocate team members, please. So, Kim, could I ask you, and sorry I didn't catch your registrar's name, Bex, could I ask the two of you to look after this child's airway, and if you're happy with the tubes in the right place, could one of you concentrate on getting IV access and sending off some bloods, please? Our primary survey doctor, that's going to be Rachel. So Rachel, could you do a B and C assessment and then articulate your findings to me as you're doing that? And are you okay doing fast scans, Rachel? Okay, can I ask you to do a fast scan as part of the C assessment as well, please? Jane, you're our PEDS consultant today, aren't you? Jane, can I ask you to liaise with the parents and family as they arrive and get any other relevant history, and also find out if there's any safeguarding issues as well, please?
Just get calculations, I can get one of the essentials.
Yeah, if you could do the calculations first and get the sort print out, that'd be really helpful. Thank you. Nursing-wise, who have we got in terms of nursing roles? Okay, so you're okay looking after mum and dad. Who's our code red nurse? Brilliant. And who's going to be doing clothes and monitoring? Fantastic. I think our patient's here, folks.
So, hi guys.
Hi Chris, I'm trauma team leader. Are we okay to do a hands-off handover, please?
Yeah, she's stable at the moment.
Okay, can everyone listen in for handover, please?
Okay, so welcome guys. We've got an 8-year-old here who was hit by a car about 30 to 40 minutes ago now. She was knocked unconscious. When we found her, she was also unconscious. Injuries from top to toe. She's got an obvious closed head injury. She looks like she's broken both of her legs. Treatment so far, she's undergone rapid sequencing induction. She's been stable throughout the whole time. She's got a pelvic binder on, she's got access in both arms, and we've been maintaining her with a standard anaesthetic, ketamine, rocuronium. We've had no airway issues en route, breathing's fine, and we've had no cardiovascular instability. Any questions?
Has anyone got any questions at all? Okay, let's get this child across. Chris, thank you very much.
So you'll notice how different this handover of a patient is to Casualty on TV and other TV programs. It's not that noisy, hustling and bustling environment. It's actually a very quiet, controlled. So long as it's safe to hand that patient over and take a few minutes, we will do so. It'll keep everything quiet and everybody will hear the same information.
Kim, are we happy this tube's in the right place? Okay, thank you.
Monitor down there. I just can't see the monitoring at the moment. Super. Quite difficult to bag. We could do with some suction actually. Paul, could you organise that for me? Thank you.
Good air entry throughout, thank you.
So Kim is the anaesthetist at the head end, Dr. Kim Sachs. She's doing a primary survey along with the ED doctor who's doing a primary survey. A primary survey means A, B, C, D, E. Do you know your alphabet? Not just yet, but you will. So A stands for airway. This is when we're looking to see that that airway is clear, this patient can breathe. This patient has a tube down their throat. This needs to be checked very carefully to make sure that air is going in, entering the lungs and delivering oxygen to the patient's blood.
Sanjay, we've got low oxygen levels here at the moment and quite a lot of blood coming up from the chest.
Thank you. Now, we've got some observations. Have we got some monitoring on? Okay. So Rachel, B was okay. You were happy with B. And there's no blood on the floor. C's a problem. Okay. So blood pressure is 80/40, folks. So I think we should start commencing resuscitation with some blood. They've already given some tranexamic acid pre-hospital. I think we should consider a second dose. Rachel, are you okay to give the first bolus of blood through the rapid infuser, please? Thank you. Claire. And could you activate Pack 1 as well, please?
Within the emergency department at Southampton General Hospital, we have a code red system. A code red system is a system we have in place in case a patient needs to have blood delivered to them very, very quickly. In the ED at Southampton General Hospital, we have a code red nurse. This is Claire here, who might give you a wave. She's setting up our Belmont transfuser. It's a machine that can deliver blood very rapidly. It can warm the blood up as well, so that we don't cool the patient. Claire is setting up the blood units to be delivered to this patient very, very quickly.
Just put the title back in here.
So we've continued with the survey. We've done B, which is breathing. We've moved on to C, which is circulation. Circulation means your blood pressure, your heart rate. This patient has a very low blood pressure. We think they might be bleeding from somewhere.
To go through, while we're waiting for that blood to go through, I think we should get a chest and pelvis x-ray done while we're here. Although I think the most likely source of hemorrhage is the lower limb fractures, and we should consider splinting this child's lower limbs while we've got the chance to do so. Is that okay? Thank you very much.
Sanjay, are we planning to move to scanner at some point? Is that our direction of travel?
Plan of action will be that we need to decide on which bits we're going to scan. I think if the child's blood pressure stabilises with blood, and the chest and pelvis x-ray are normal, then it'll be a CT of head and neck. If there's any other injuries identified, we might need to consider a trauma CT, but that's our direction of travel. So we should anticipate packaging this child for CT whilst we're awaiting the response to blood.
So somebody on the phone to CT to alert them.
Yeah, we should do that now. Bex, is that okay? Thank you very much.
They're waiting.
So we're anticipating that this patient may need to go to a CT scanner. In the emergency department at Southampton General, we try to do this within 15 minutes of the patient arriving if we can.
Alison, are you doing drugs at all? Could you prepare a protocol infusion for me, please? Thank you.
So, reassessing this child's blood pressure has now come up to 100 systolic. The chest and pelvis x-ray have been done and they're normal. So I think we're in a position to move to CT. Bex, is CT all good? So we're going to do a CT head and neck. So I think we should go through our transfer checks now. So tube we're happy is in the right place. Have you got drugs for transfer?
We're just getting a propofol infusion ready. That's not quite ready yet.
Okay.
So moving to a CT scanner or to any other clinical area is a dangerous task, and we need to make sure that this patient is safe to be transferred and that they can get to that CT scanner and we can deal with problems as they arise. We're going through a trauma checklist that we have to make sure we don't miss vital elements in that transfer period.
Okay folks, I think we've gone through all of our checks. Kimmy, you're happy that we're disconnected at the top end?
Yes.
Okay folks, are we ready to go to CT? Okay, should we make